Certified Hyperbaric Technologist Practice Test 2026 New Real 30 questions. Question 1. Boyle's law states that if temperature remains constant, the volume of a gas is directly proportional to the pressure, inversely proportional to the pressure, equal to the pressure, not affected by pressure. Boyle's law, P1V1 equals P2V2, means as pressure increases, volume decreases. This is critical for understanding barotrauma. Question 2. What is the most common side effect of hyperbaric oxygen therapy, HBOT? Oxygen toxicity, middle ear barotrauma, claustrophobia, fire. Middle ear barotrauma, difficulty equalizing pressure, is the most frequent complication. Question 3. Which NFPA document sets the safety standards for the operation of hyperbaric chambers? NFPA 70, NFPA 101, NFPA 99, Chapter 14, NFPA 13. NFPA 99, Chapter 14, is the gold standard for hyperbaric facility safety. Question 4. A TCPO2 measurement is performed to assess blood glucose, tissue oxygenation and healing potential, carbon dioxide levels, heart rate. Transcutaneous oximetry, TCPO2, measures the oxygen tension in the skin to predict if a wound has enough oxygen to heal. Question 5. Which gas law relates the total pressure of a gas mixture to the sum of the partial pressures of each gas? Henry's law, Dalton's law, Charles's law, Boyle's law. Dalton's law P, total, equals P1 plus P2 plus Pn. Question 6. What is the standard treatment pressure for a U.S. Navy treatment table 6? 1.5 ATA, 2.0 ATA, 2.8 ATA, 60 FSW, 5.0 ATA. Table 6 is used for decompression sickness and air embolism, reaching 60 feet of seawater. Question 7. Which condition is an absolute contraindication for hyperbaric oxygen therapy? Diabetes, untreated pneumothorax, claustrophobia, cataracts. An untreated pneumothorax can become a tension pneumothorax during decompression, which is fatal. Question 8. What is the maximum allowable oxygen concentration inside a multiplace hyperbaric chamber according to safety standards? 21%, 23.5%, 50%, 100%. To prevent fire hazards, the ambient oxygen in a multiplace chamber is kept below 23.5%. Question 9. A CHT should use which substance to clean the acrylic viewport of a monoplace chamber? Alcohol, acetone, approved mild soap and water or specific acrylic cleaner, abrasive scouring pad. Alcohol and harsh chemicals can cause crazing microcracks in the acrylic, compromising structural integrity. Question 10. Henry's law states that the amount of gas dissolved in a liquid is proportional to the temperature, the partial pressure of that gas, the volume of the liquid, the color of the gas. Henry's law explains how nitrogen dissolves into tissues under pressure. Question 11. Which type of decompression sickness, DCS, involves the bends, joint pain? Type I, Type 2, Type 3, Type 4. Type I DCS is pain-only joints/skin. Type 2 involves neurological or cardiorespiratory systems. Question 12. During decompression, why must the rate of ascent be controlled? To prevent the gas from expanding too rapidly in body cavities. To make the treatment take longer. To save oxygen. To keep the patient warm. Rapid decompression can lead to barotrauma and the formation of gas bubbles in the blood, DCS. Question 13. Which symptom is a sign of central nervous system, CNS, oxygen toxicity? Coughing, muscle twitching/seizures, joint pain, hunger. The vented acronym, vision, ears, nausea, twitching, irritability, dizziness, describes CNS toxicity. Question 14. What is an ADA in hyperbaric medicine? Atmosphere's absolute air tension amount, altitude to air, active treatment area. ADA is the unit of total pressure, including atmospheric pressure, 1 ADA at sea level. Question 15. Fire safety is critical in HBOT because oxygen makes everything more flammable. Chambers are made of wood. Static electricity is impossible. Patients are cold. Oxygen-enriched environments drastically increase the rate of combustion. Question 16. Which medical condition is a UHMS-approved indication for HBOT? Chronic fatigue syndrome, carbon monoxide poisoning, autism, stroke. Carbon monoxide poisoning is one of the 14 UHMS-approved indications. Question 17. What is air embolism? Air in the stomach. Gas bubbles entering the arterial circulation. A type of skin rash. Normal breathing. Arterial gas embolism, AGE, is a surgical emergency often caused by lung overinflation during ascent. Question 18. Before a patient enters a monoplace chamber, the CHT must ensure they are wearing 100% cotton clothing, polyester workout gear, wool sweaters, silk pajamas. 100% cotton reduces the risk of static electricity, which is a fire hazard. Question 19. What does FSW stand for? Feet of salty water, feet of seawater, forward surface weight, fresh soft water. Feet of seawater is a unit of pressure used in diving and hyperbarics. Question 20. How many questions are typically on the CHT certification exam? 50, 120, 200, 300. The CHT exam consists of 120 multiple choice and true/false questions.